Okay, so now I'm going to launch into some of the key findings from our April 15th report. So I'm going to take a few minutes and let's talk about the data summary that we have in place. The Inclusion Connect's quarterly report does cover the period of October through December of 2025, and the full report is posted on the Inclusion Connect's website as of April 15th, 2026. Inclusion Connects is the North Carolina Department of Health and Human Services program that connects people with intellectual and developmental disabilities to more choices and more access to services and supports. This program is a collaboration amongst North Carolina DHHS divisions, including the Division of Mental Health, Developmental Disabilities, Substance Use Services, Employment and Independence for People with Disabilities, and Medicaid to provide resources for connecting people of all ages and abilities with IDD to the services and supports that make it possible for them to live, work, and thrive in their chosen communities. Inclusion Connects focuses on improving access and enhancing the housing array for people with IDD, promoting access to services for people in need of services, including those who are on the Innovations Waiver waitlist, addressing the direct support professional or DSP workforce shortage, and supporting competitive integrated employment through Inclusion Works. One of our main focuses is access to community living. As part of the report, we report on InReach, transition planning following InReach, and diversion from institutional settings. Institutional settings include intermediate care facilities, or ICFs, including the 3 state developmental centers, psychiatric residential treatment facilities, or PRTFs, adult care homes, or ACHs, and other institutions. Next slide, please. InReach is the act of intentionally and purposefully educating people with disabilities in an institutional setting and their legally responsible person on the benefits and services available in community-based settings. While this is done primarily in person, it can also be done by telehealth and other communication methods like phone calls or emails. It also provides opportunities for meeting other people who live in the community. The purpose of InReach is to provide information and education for the person and their family and supports to make it the best, most informed decision for their individual circumstances. InReach processes are in development to standardize the frequency and informed decision-making process for all people in institutional settings. This quarter, we saw a slight decrease in both face-to-face and non-face-to-face InReach from the previous quarter. Rates of people in institutional settings also decreased slightly. It's important to note that there's no expectation for the number of people who receive InReach to increase over each quarter due to the current lack of standardization across the plans. At this time, reports indicate people receive InReach typically annually. We expect people to receive InReach regularly because people's needs and the system changes over time. For example, 5 years ago, there were no 1915I supports. So if you did not have the Innovations Waiver, there were really very few other options for services. With the addition of 1915I services, we want to make sure that people know what choices they have as are potentially available to them. Next slide. This slide shows data related to the number of people who choose to participate in transition planning or moving after they receive InReach. There are currently 108 people, or about 28%, participating in moving planning after receiving InReach. Community settings look different for different people. This could mean living in a house or an apartment with friends, living in a house with family, living on their own, or any other number of types of living situations. For those who didn't choose to move, it could be for a number of reasons as well. They may have lived in their current location for the last 20 years and consider that home. They may need significant medical or behavioral supports that they don't believe can be duplicated in a family or community setting. The goal is to ensure people understand what is possible, what is available to them now, and ensure that they have the information they need to make the right decision for their current situation. Next slide. This slide shows data on diversion and transitions. Diversion involves identifying people with IDD who may be at risk of moving into an institutional setting and connecting them with services they need to stay in their own home and neighborhoods. This may mean linking to 1915I services, mental health services, other possible waivers, or other state programs. When you look at the orange line, you will see we saw a decrease in those who were diverted in the reporting quarter. And this represents the first report that was submitted using the standardized definition of diversion eligibility. We do expect some variations as the plans continue to work on identifying those members eligible for and participating in diversion. This chart also includes the number of people who moved out of institutions. It's represented on the blue line. We expect to see this number fluctuate over time as waiver slots become available and people indicate the desire to move. So as I mentioned earlier, there are more services available now than ever before, including the 1915I services, state-funded services, and other possibilities that are not specific to people with intellectual and developmental disabilities, but are available to meet people's needs. The waiver is still available, but there's a tremendous wait list that continues to grow. Next slide. So as I mentioned, we do monitor the number of people who are on the wait list and those who are receiving IDD services while they wait. The Innovations Waiver is a program that allows for an array of IDD services to be provided in the home and in the community. For years, this was the primary source of services for people with IDD. The Innovation Waiver relies on allocation of slots from the General Assembly. So there are some years where we get slots allotted, and there are some years that we don't. For the most part, we continue to rely on vacated slots to bring people onto the waiver. People vacate their slots for a variety of reasons. There are some people that may move out of state, they may move into an ICF or other institutional setting, or they may pass away. Or in some circumstances, they may feel that they no longer need the slot or that they no longer need those services to meet their level of care. As you can see on this slide, there's currently 20,893 people on the wait list as of December 31st, 2025. Next slide. As I mentioned, there are a finite and additional slots must be allocated by the General Assembly. Next slide. Currently, there are 14,736 total waiver slots. As of December 31st, 2025, there were 14,161 slots being actively used. So that means there is a person assigned to that slot that is receiving and also billing for services. There are 486 inactive assigned slots and 89 remaining reserve slots. Reserve slots are those slots that are reserved each year for military transfers, emergency slots, transitions from the Community Alternative Program for Children, which you may hear referred to as CAPC, and Money Follows the Person, which you've probably heard referred to as MFP. MFP is a program designed to support people who choose to move out of institutional settings and into the community. An inactive slot has a person assigned that isn't billing against it. This sometimes happens if someone is new to the Innovations Waiver, since it can take 90 days to enroll, especially if the person is going through disability determination. They've temporarily entered an institution, like what could happen if a person has surgery and needs to go into a skilled nursing facility for rehab, or if a person has passed away. Inactive slots are not reassigned until the beginning of the fiscal year. Next slide. But again, there are services while a person waits for an innovation waiver slot. And for many people, the 1915I service options may meet their needs to live at home and in their neighborhood. During this reporting quarter, we noted 9,662 people, or close to half of the people on the wait list, were able to access an IDD service while they waited. We're really excited to see that number increasing. There are more details on the Innovations Waiver waitlist dashboard, including demographics, other services that are accessed, wait time, and looking at the number of people with Medicaid. One thing we noticed, there are significantly more people with Medicaid than the number of people accessing IDD-related services. All of this data and those discrepancies are used to help guide program design and service implementation. Next slide. So while we're interested in the services people are accessing while on the wait list, we also want to increase access to 1959 for all eligible people with IDD. 1959 is inclusive of community living and supports, respite services, supported employment, and community transitions. Tailored care management is not a 1959 service and is not included here. During this quarter, we saw an increase in the number of those who received 1959 services, and there was a decrease in the number of assessments completed and approved. However, that may be due to seasonal fluctuations related to the holidays and is something we will continue to monitor. So just because someone has an active authorization or bills a single unit in a quarter, that does not indicate true access. We can authorize all sorts of hours, but there's not a direct support professional to work those hours. Then are we really addressing access? Next slide. So in order to monitor workforce health, we look at the number of community living support hours authorized versus the number of community living and support services that are actually billed. We set a utilization target of 85%, which means that we want to see people using 85% or more of the hours they're authorized for. This number is set at 85% to allow for vacations and time off, since people do get sick and they have their own personal emergencies or they have emergencies with their own families. As you can see for this quarter, next slide. As you can see for this quarter, VIA and partners both exceed, nope, sorry, go back. VIA and partners both exceeded the target of 85%, while Alliance and Trillium were below the target. We continue to work with our tailored plan partners to understand what the possible barriers are to hitting the target, but also to learn from the successes in those tailored plan areas where the target is being reached. Next slide. For the first time, we've included a chart to start looking at trends based on authorized units not being provided due to the lack of staff availability. We want to recognize the efforts of our partners at the tailored plans and the providers who work to provide high quality data. We encourage learning from each other to support people with intellectual and developmental disabilities across the state and recognize that there are some amazing innovations that are being implemented to help support people with IDD. Next slide. So I'd like to turn it over to Lauren Spencer to give an overview of the Innovation Waiver Waitlist dashboard updates.
Good morning, y'all. It's nice to be chatting with y'all again. So we have been able to update the Innovations Waiver Waitlist dashboard with information and data related back to the same quarter Tina has been talking about all along. There are no new features this quarter, so it should look pretty similar to previous iterations, barring some of the data. So as Tina had previously mentioned, we do continue to see the total number of people on the Innovations Waiver waitlist grow. So we are currently just shy of 20,900 people waiting on an Innovations Waiver slot today. We do, however, continue to see things remain relatively stable in that we see far more males waiting for a slot than females. The average age has stayed the same, and we do see that autism spectrum disorder is still the most commonly listed diagnosis as a need for this service. Next slide, please. We were also able to update the average amount of time that folks have spent on this wait list that are still currently waiting. So this does not include people who have previously been offered a slot and have chosen to remain on the wait list, but not move into that spot. And it also does not include people who have had several attempts to reach out to them to offer a slot. But this information, generally speaking, is very similar. It is still at, if you rounded slightly, at 5.8 years on average across the whole wait list. Next slide, please. And finally, again, pretty similar information here as far as services that are being accessed by our folks who are waiting on an Innovations Waiver slot. We do see that the number of services that are being received on average by people receiving services has stayed the same at 2. And there's still 81% of people on the wait list who have Medicaid from this past quarter. The thing that we do see, however, is that there are more people, more absolute people who are receiving services. So we see an increase in the total number of people receiving any kind of service, in addition to an increase in the number of people who are receiving IDD specific services, which we're really excited about.